it's time for us to have a conversation on the health segment. And as you very well know, it's Breast Cancer Awareness Month. And today we're going to be talking with Dr. Kelvin Owusu about risk factors. That possibly cause breast cancer. Now, this segment is sponsored by the Farmers Market. Farmers Market, 100% healthy and hygienic. Yes. Dr. Kelvin.
Yes, David.
How are you this morning?
Very well, and you?
I'm super fantastic. Now, so let's talk about, there's a whole lot of different conversations that we can have about breast cancer and the awareness and all of that. We've talked about the fact that if it's caught early, it can be dealt with, and that's the key really for us to deal with this. Now, let's look at the factors that typically would expose one to breast cancer, predispose one, I should say. Yeah, to breast cancer more so than others. So let's take a look at what those are.
Okay, so it's breast cancer. It's important that we have spoken about. We have dedicated a whole month to talk about breast cancer because in Ghana, it's actually the number one cancer cause of death in women. Okay, and so that gives us the first risk factor, which is the fact that you're a woman. But then there's a caveat. Now, breast cancer is cancer of the breast. Okay. Now, both men and women have breasts. Yeah. So it means that both men and women can actually develop breast cancer. But because you're a woman or because you have more breast tissue, women have more breast tissue. Okay. And so you are more likely to develop breast cancer than a man would. Okay. However, if a man develops breast cancer, it's more aggressive because they have less breast tissue. Okay. So there's not enough space, there's not enough room for the cancer to actually develop in the breast. So it spreads much faster, much easier, and causes more damage. Okay. And so both sexes are at risk, but the woman is more at risk.
Okay, so by extension, can we then say that in males, if you get it, the spread to other organs
is much faster.
Much more likely.
It happens earlier, and it happens faster. It spreads much quicker. Okay, so that's the thing. So a man develops breast cancer. It must be attended to more aggressively, than a woman. For when you are comparing the two sexes. But let me also be quick to add that it's not necessarily a function of the size of your breast. So, for instance, you cannot say that because this woman has bigger breasts than this woman, it means automatically her risk of developing breast cancer is higher. I know there's a bit of confusion because I mentioned that because women have more breast tissue. Yes. But you see, breast size is not only as a result of breast tissue. There's also the element of fat. So it's possible that you may have big breasts, but there's more fat than breast tissue. So that's just to put in perspective that it's not necessarily the size of your breast. So the fact that you are wearing a double D cup or somebody who wears an A cup means that the one with the double D is more at risk. Not necessarily. It's possible, but not necessarily. But ultimately, once you're a woman, you are at a higher risk of developing breast cancer. Okay, then the next thing is age. As you grow older, the possibility of developing breast cancer also increases with age. And so obviously that is why you need to be screened more frequently as you are growing older. And in fact, by the age of 40, you should be doing mammograms every 2 years minimum.
From the age of 40?
From the age of 40 going. And even that there's a condition, which will bring me to my third risk factor, which is family history. If there's a family history of breast cancer, then you probably have to start your mammogram at an earlier age or at a younger age. But if there's no family history, then 40 years and above, you have to do a mammogram every 2 years minimum. It has to be done. And then, so these are you cannot modify your sex, so that's a risk factor. You cannot modify your age, that's a risk factor. You cannot modify your family history, so these are non-modifiable risk factors. Then there are the modifiable risk factors. But before then, there's one more non-modifiable. The age at which you had your first menstruation is very important.
Really?
Yes.
How so?
Okay, so there's a hormonal aspect of breast cancer. And women who have had a prolonged exposure to the female hormones, estrogen, are at a higher risk of developing breast cancer. So the age at your first menstruation, usually people who have their menstruation before the age of 10, so 9, 10, thereabouts, and then people who have late menopause, so you had your menopause around 50, it means that you have had a prolonged exposure to the female hormones. And so your chance of developing breast cancer is increased, is higher. Related to this is the number of pregnancies you have had. or the number of successful pregnancies you have had. Because every time you get pregnant, there's a break in the female hormones.
Okay.
So you give yourself 9 months of rest from the female hormones. So the number of pregnancies you have carried successfully, it reduces your chance of developing breast cancer. Okay. Of course, this does not mean that you should go and born plenty, because and here's the catch. The more children you have, the higher chance of developing cervical cancer.
Oh wow!
And so it's a balancing act. You have to actually balance the two, because the more pregnancies you do have, the less your chance of developing breast cancer. And then, but on the other hand, the more pregnancies you have, the higher your chance of developing cervical cancer. You know, so it's a balancing act. So related to pregnancy is breastfeeding. Women who also breastfeed tend to prolong the break. So if you do exclusive breastfeeding for 6 months, most women, the estrogen level remains low for the period of the exclusive breastfeeding. So when you add that to the 9 months, that's a break of about a year. A year and some months. And so it gives you some respite from the female hormones. And so it helps you reduce your risk of developing breast cancer. So now we go to the modifiable lifestyle. So if your diet is terrible, if you're eating all sorts of foods, you're exposing yourself to cancer-causing agents. You know, so fast foods, oily foods, especially oil that is reheated. I mean, we know that the impact of reheating your oil, reusing oil, the polyunsaturateds keep going up, and all those can cause cancer. You know, then we also have alcohol and cigarettes. Now, these two cause almost everything in the known to the surface of this earth, from hypertension to cancer, and they cause cancer in every part of the body, including the breast. So women who smoke and women who drink alcohol expose themselves to breast cancer as well, you know. And so and sedentary lifestyle can, and it's interesting, sedentary lifestyle, you might think that you think that it's only causes you heart problems and all that, but actually it also has implication in other aspects of cancer causing as well.
Sedentary lifestyle.
So basically, if you live an active lifestyle, and people who live an active lifestyle also tend to be health conscious, so they watch what they eat, you know. So if you're eating a lot more fruits and vegetables, you're getting in a lot more antioxidants and vitamins, minerals, you are helping yourself to reduce the chance of yourself developing breast cancer or any other cancer for that matter. So it's important that we put all these things in perspective.
Okay. So let's talk about the subject of alcohol. There's also in some literature out there that wine is good for you.
I knew this question was coming.
Yeah, and I mean in terms of moderate use of wine. How much wine is too much wine?
Well, they say that, I mean, I like the key word, you said moderation. Yeah. You see, because this thing about wine, it's not just all wines, it's specifically red wines. Okay. Because there's an element in the red wine called resveratrol, which is in the skin of the red grape, which is good for the heart. Yeah. It helps the heart to function better, live longer. All those benefits are there. But it's to be taken in moderation. Okay. Now, the problem is how much is moderate. Yeah. You see, because they talk about a glass of wine. Now, what's the size of your wine glass? So there's a lot of subjectivity in that definition. However, we will say that about a unit of alcohol, but even then, that unit of alcohol is difficult to define per the glass standard, because there are so many different glasses, different volumes of glasses. It's quite complicated. Because a volume of alcohol can be in a glass of beer. So let's say in Ghana we have two sizes of beer, the mini and then the large. So the mini bottle of beer can have about 1 unit of alcohol. But again, it depends on the percentage of the beer we are talking about. So if you have beer of, let's say, 5% alcohol, then that mini bottle, which is about 300 mils, could actually be 1 unit, 1.5 units. Okay. But then the big bottle would be about 3 units. You see, so how much alcohol are you actually taking? Then there's the aspect of tolerance. The more alcohol you drink, your body sort of develops tolerance to the alcohol. So if you drank 1 glass, and as they say, a bow and so, if you can actually feel like yes, you get tipsy 1 glass. If you kept drinking that 1 glass of alcohol every single day, it will get to a point that 1 glass will not make a difference. So now you increase it to 2 because you still want to feel the impact. Now you're developing tolerance. So now you might have to drink 3 glasses before you feel the same way you're feeling before. And before you know it, 5 glasses. Meanwhile, your liver is also beginning to complain. So you are going to now start developing fatty liver disease or alcohol liver disease and complicating, now getting to cirrhosis and all. So bottom line is moderation. Okay. You should know yourself. If you stick to 1 glass of red wine, you can get some benefit from that resveratrol. Of course, you can also get non-alcoholic wine, all the better, because the resveratrol is not an alcohol component.
It's from the grape.
It's from the grape.
Okay.
So whether the grape you are taking is fermented or not, you are still getting
your benefit.
Exactly.
Okay. So let's wrap up on the risk factors. So what does one need to pay attention to, in terms of making sure that these risk factors that you've mentioned, we nip it in the bud or deal with it?
Okay, so I already mentioned that some of them you can't do anything about, like your age and your sex and family history, But once you are aware that my family, my mother or my auntie or my sister or my cousin has had breast cancer before. You need to pay closer attention to your own breast. And I keep saying this at all the screening and education events I've been having, that no one can know your breast more than you. So it's important that you do your self-examination, because if you came to me for a breast examination, it's a snapshot. I'm just seeing you today. So even if I'm to pick something, I will not get the full picture. You might have to come again and again before we know what's happening. But if you have been doing the examination yourself and you know that this was not there before, or that this was there but now it seems to be getting bigger, then it gives us more of a better picture. So you cannot overemphasize the need for every woman and man to actually examine their own breast as often as possible. And it's so easy to do. I mean, there are several videos on YouTube and Facebook showing you how to do your self-examination, and then have a professional examine you at least once every year, so that you know there. Exactly.
So your hand above your head.
Exactly. Yeah. The hand above your head. The idea of having your hand above your head is so that you can see the entire breast. Okay. More importantly, there's a portion of the breast that is in the armpit, and so when you're examining your breast, you must make sure that you actually put your hand in your armpit and feel the armpit as well. Area. Yes, because there are lymph nodes there that also supply the breast. That if there's a problem, they'll get inflamed. So you must make sure that your hand is going all the way into your armpit to check for all those things. So if you find something in your armpit, don't think or don't assume that it's a draw. Don't assume that it's just, no. It could be something related to the breast. So report quickly and have it assessed. So that if it's better to have a clean bill of health than to ignore something and suffer the consequences later on. Because breast cancer actually does spread fast, regardless whether it's man or woman. But it spreads faster in the man than in the woman. That's just something to know. Okay, so
finally, the risk factors, you're talking about the fact that if it's in the family, right? So you're looking at, maybe my grandmother had it. As a man, does the risk factor in terms of genetics also affect me?
Yes, it does. Once there's family history, and it's not only breast cancer. There's a partnership between some cancers. So breast cancer, ovarian cancer, and I think uterine cancer. I have to confirm the uterine cancer. But these three, they run in families. So once you have any family history of, let's say, ovarian cancer, you should be on the lookout for breast cancer as well. Because whether you're a man or woman, if you're a man and your mother had ovarian cancer, you, the man, should pay attention to your breast, because you could have a breast cancer in the future. So you should check it out and make sure that things are not, and you are not taken by surprise.
Thank you very much. All right. So, Dr. Kelvin, how can people find you? Can people reach you?
Well, I'm active on Instagram at Kelvin Owusu, and also on Facebook, same Kelvin Owusu, and then Twitter at Nasa Puku. And we're actually doing a free breast screening this Friday at Velvet Medical Center in Kwabenya area. So just pass through and then get some medication and get some screening done as well.
Fantastic. Dr. Kelvin Owusu has been speaking to us about the risk factors for breast cancer, and Dr. Kelvin Owusu is the MD for Optimacare Diagnostics.
Hi there. We hope you enjoyed the show.
Make sure to subscribe, like, comment, and share with your friends.
This is Breakfast Daily on City TV.
Join the Breakfast Daily team Monday through Fridays from 7:30 a.m. to 10. Join us for breakfast daily, only on City TV.